Thank you very much. So this is a patient who is a grandfather. He had an uneventful cataract surgery in our clinic a few years before. PCOL in the bag, everything fine, but his nephew hit him in this eye and he came to us with a dislocated bag. Only in the superior part of the eye we could see that the bag and the superior haptic was out of the, in front of the iris. We said, okay, it's not very difficult, we will implant a CTS, sutured sclera. We prefer Gore-Tex because it's for life. So I didn't have too much, let's say, worry. I didn't worry too much that it will be more difficult than expected. And it really was. You saw we perform UBM. In UBM, the inferior part looked quite stable, so we said maybe this CTS is enough. But when we pulled the suture and didn't pull too much, just a little bit, we noticed that neither the inferior, neither the superior but not the inferior part was stable as well. So the zonule was broken or very enlarged inferior in the inferior half as well. So we decided for another CTS, which is not available, although we always have two CTS in the OR. At that moment we didn't have. What we found instead, we found a Sioni ring, so a capsular bag with hook, and we said, okay, we prepare to suture it in the opposite side, 180 degrees apart. Again with Gore-Tex, everything seems fine, and we start to tighten the sutures very, very softly, I say, very careful. But when I tightened the suture, the inferior suture, I noticed that the superior one, although it was quite loose, the superior one is decentered. So as you see, the margin of the first CTS appear in the pupillary area. And I didn't know what happened. I assume that the CCC was broken. My intention was to pull it back in the bag and to see what it will happen. It was not good at all. I said, we need to get this problem right. And in a few days, you saw the picture the very next post-operative day. And a few days later, I decided to enter again to see what's going on, to withdraw everything and to put a new IOL sutured sclera. Taking out CTS is not very easy. Neither the CTS and especially nor the Sioni ring. You will see that you need to have, of course, plenty of OVD to protect your cornea, to support the back of the iris, but it is quite difficult because it's large, it has a large diameter, it has a long length, let's say, and yeah, this was the most difficult part of the surgery, removing the Sioni ring. But everything careful, slow motions, first withdrawing the Gore-Tex suture with a knot, and again coming back, anterior vitrectomy via pars plana. Of course, this was done even once before but not shown in the video, and now I did it once again. And here I caught the one head of the Sioni ring, but be careful, it is with the other end, it has caught some zonules, some vitreous strands. Don't pull them, very careful, cut them with a vitreous cutter. Again, the other end of the ring is caught with some, no more vitreous because I did vitrectomy, but there are some strands, maybe the zonules, some remnants of the bag which are there. And now I only have there the IOL, which is the easiest part of the surgery, removal of IOL. It's something that I do quite frequently. I cut it in two pieces, not 100%, only 90%, and by rotation maneuvers, I will manage to withdraw it through 3.5 millimeter incisions. Again, with anterior vitrectomy via pars plana, you want to have very clean anterior chamber, very clean space behind the iris. You might use triamcinolone, of course, and this is my preferred technique when I don't have capsular support at all, implanting an aqueous IOL with Gore-Tex. I'm getting out at 2 millimeters from the limbus, 2.25 and 4 millimeters apart. This is how the eye looked a few days later, and now that was the trauma happened in the Christmas time, and now he is doing very well, the patient. There are some lessons to be learned in trauma cases. You have to be prepared with every bad possibility that you might encounter during the surgery. And my second lesson or advice, let's say, I would say never implant a Sioni ring after you implanted a CTS, because it's too long, and in your maneuvers to push it 360 degrees can dislocate the previously implanted CTS. Thank you for watching.